Research topic and research title, do they mean the same thing? That many people actually use that interchangeably. So when I saw the topic that was made for us to discuss, I then also said, okay, maybe it's better we cover whether it's a topic or it's a title as it were. Because in the stricter sense of the word, a research topic is not entirely the same as a research title. A research topic is not exactly the same as a research title. And the difference would lie in how broad the discussion is. I think I have an example here. In fact, here I've made it a bit even more, a bit more, will I say, complicated area. So a research area is talking about just a broad, quite very broad field of study. So using this example, when you talk about the adolescent health and tobacco control, that's like an area. Again, some people will refer to research area to mean like a research topic. Then research topic then becomes a bit more specific than that, whereby the subject of interest is within the research area. So again, it can be adolescent susceptibility to tobacco use and effectiveness of health education methods in preventing that susceptibility. Now, that title is what you then eventually then have on probably your thesis or your proposal, your thesis, your manuscripts, which is even more coincide, it is focused, and then it reflects the. An example here can be susceptibility of adolescents to tobacco use and the relative effectiveness of health education methods in cluster randomized control trial. That one has added even the methodology, the study design that was used in it. Again, why have I raised this? Say that in this presentation, we're going to be using the word research topic, and we're going to probably cover all this range. So it's going to be seen as a title many times when I'm referring to a research topic, because I have a sense that that is what people even have in mind already, but just to create this distinction. That said, talking about um, formulating research topic, the objectives of this part is to talk about understanding the importance of a well-formulated research topic, learn step-by-step approaches in formulating a research topic, gaining practical tips for refining and analyzing the topic, and then with the research goals. So why is it important to have a well-crafted topic serves as a compass for impactful and meaningful and successful research? First is it helps to define the research scope. So again, look at somebody's research topic or the research title, it should be clear what the scope of that study is going to be. You can't have adolescent health and tobacco use. That gives us a broad area of where you are focusing, but it's too big, it's too wide that we know you can't do all of that. So a good research topic, or in this case, a research title, whatever it is, gives us an idea. And using the example of the one that I have here, oral health in children, is there's a lot of things concerning oral health amongst children. When you compare that with effectiveness of oral health promotion in preventing gingival diseases among orphan children in Ibadan, you see that that is a lot more focused, and the objectives or the aim of the study is already even projecting from reading it. So one of the important things is that when you see a research topic, it helps to convey or define the scope. And then when you are drafting or formulating your research topic, definitely it needs to align with your research objectives, your aim of that study. But it also should address, people should see it and see the relevance of that. What impact will this have? Again, I'm using the example of oral health promotion and preventing gingival diseases among the children. That already told us what is this usefulness. Its usefulness in terms of practice, in a sense of probably if this works, then we can be talking about the potential impact on maybe policies around that thing. So I think this is something that would also need to, one of the importance of it. Again, it helps to guide the research design. And so I remember one of my students then when we were saying, okay, come up with research topic. And she gave a one that was the time of COVID. She gave a wonderful one that was about the getting the vaccines, right? That we needed for take care of COVID. That was again the time of COVID vaccine. But the question I then asked her is, she wanted to do this cross-sectional study. So I then said, no. Since this is your research topic, the study design to be able to get this out is not going to be a cross-sectional study. So what you have as a topic will again give us an idea. And in standard practice, in good practice, even says that that study design should be included in the title. And again, example is what we have seen here. Susceptibility of adolescents to tobacco use and the relative effectiveness of education methods, a cluster randomized control trial. And that is the study design. You will see some they write a comparative study. You see others who find a qualitative assessment or a review of literature, a systematic review, you know. So when you a good research topic, the good things about it is that it gives an idea as to what the research design is about. It facilitates communications and collaborations. Again, it was called sometimes recently this year that the Commissioner of Women Affairs and Children wanted to see me. And then, and you know, we started discussing as to who she would like to partner with me on something around and oral health interventions for elderly children and the vulnerable groups in your state. So why was that? Because I applied for permission to be able to conduct my study amongst orphans in Bali. And the file got to her table. She saw the title, she saw the topic, and she was like, this is nice. I think I'm interested in this. Why don't I collaborate with this person to be able to do some of these projects? What does that mean? It means that the topic, just seeing the topic. Remember, I didn't send the proposal. It was a letter that I wrote. Oh, please need the permission to conduct this study titled so amongst children living in Northern Ibadan, your state, Nigeria. And just seeing that, it already communicated what I wanted to do, and now she's talking about collaboration. So again, one of the important, and that's why we must do a good uh, research topic, formulate a good research topic, because when you apply for grant, the assessor or the reviewer, right from the title or the topic of that proposal, it's already thinking, oh, do I like this? You know, they don't have a lot of time to review. They've been sent several of these proposals for them to review. They have a short time. Right from seeing what the title or the topic is, they're already forming or having their minds made up on that work. Quite important. Good research topic. Again, a good research topic must be specific and clear. Like I said, it provides focus, avoids ambiguity, and the research direction is well defined. Again, it should be relevant. Sometimes people say, again, I interact with students a lot. I supervise students, and many times in research, and it comes and says, okay, what do you want to work on? Can you bring three research topics so that we look at it? And then the person comes up and I think, really, what is the usefulness of this? What is the point of things? How is it going to make impact? What what are you bringing to the table? Remember, a lot of people during the time of COVID-19 started working around COVID-19. That is going to be useful. It's going to add to the body of knowledge. So a good research topic, and a research topic again encompasses what the research is about. It communicates what the research is definitely going to, what you're working on should be relevant. And then feasibility. Again, this is where many people also possibly get it wrong. Going back to the students, the example I gave before, wanting to be able to develop or see the effectiveness of COVID vaccine, and this is an undergraduate dental student that has not more than 3 to 6 months, in fact, less than 3 months to start and complete her research, undergraduate research. The question within that time, do you have enough funding to be able to carry it out? Particularly when we know that we have constraints of funding. I'm in Nigeria. So when you see research topic, again, one of the things is it has to demonstrate that this will within the time period. People would apply for grants, and because they want to win that grant, they are so eager to win the grant. This is a grant called for 5,000 US dollars. And then they build a study that would last almost 2, 3 years on it, have a baseline, do an intervention, we provide this treatment, very robust. The first thing that will come to the reviewer is, are you, he or she has written down. So it is important that I think there's a slide that then says, what can we do when we're in situations like that, where there's constraints? Maybe I should just say it. Study. Now, is saying this is just a small part of the bigger project that we'll eventually do. So when I see something so big that shows, oh, this is going to be a very big project, but the title or topic already contains a pilot study. Recently, I was involved with, in fact, we just completed that study where we're going to look at the cohort of adolescents over several years. And then we put that into feasible currently with what we are doing. All these things that saying that it's a pilot, we know that, okay, this can't possibly be feasible. It has to be original, innovative. The point here is that don't reinvent it should be something new. There's no point coming to report what people have reported very well. He's talking to the students again. He says, I want to assess the tobacco use among adolescents in Ibadan, Nigeria. Okay, very good. The justification for my study is that there's a lack of studies in this area. I said, okay, very good. Then the same person now writes in the literature review and says that Lawal Eto reported that was smoking amongst 12%. Ibiye reported the prevalence of, and then say, but you said there's paucity of data. That's the justification for the study. Now, in your literature review, you've given me three studies that have been conducted in the same Ibadan. So, what is the new thing that you are bringing? We need to think about it in that way. What are you bringing? And I put here ethical there because, again, even in drafting your research topic, there are some ethical issues that you want to think about. For example, when you say HIV patient, tobacco smoker. Now, the wording, I'm sure people, those of particular people in the West, are already very sensitized to issues like this, or um, people who smoke, rather than trying to label them. So, this is just a point to say when you are formulating your topic, you should also be sensitive to how you craft that. Some people will say subject and subject. No, we don't use words like subject again as well. They are not subject, even in the topic. So now let's talk about the steps in formulating a research topic. Again, this is just something I'm sure all of many of us have taken part in research. First is to say identify a broad area of interest. So in this presentation, I should have said that earlier, I'm going to be using probably examples of the most of what I'm going to do. Again, is to try and break it down to say, okay, this is my experience about it. I'm walking around tobacco and my part two residency project, a law on tobacco, masters in global health, was in tobacco related, my MPH is also tobacco related. So how did I get into that area? I'm a dentist, residency in community dentistry, and then I was going to take up masters in global health, and they had different tracks, one of which was tobacco. And I felt, oh, okay, this is medical or public health, but tobacco control is an area that we don't have a lot of specialization in dentistry, and it's quite relevant. So why don't I go on towards tobacco control? Yeah, this will advancement in that area within dentistry. I'm like, okay, yeah. And I went towards it. For some people, it's something probably that happened in the past. Interest generally is one of the things that make us say, okay, this is an area that we want to go to. So that's talking about, let me the research area. Identify that area. I would say for many, what would advise or suggest is that you have an area that you want to specialize. You have an area that you want to specialize in. It may be a good idea for you to start working or bringing out research topics in that area. So even sometimes when we have people rotate through my unit, I'm in community dentistry unit at the University College Hospital Ibadan, doing their rotations, maybe resident doctors. And now they are expected to undertake research, mini projects where they are in the unit. Okay. You are a resident in conservative dentistry. Okay. So even though you are with us, sometimes I have a discussion around, can you look for a topic that is related to conservative dentistry? Because eventually that is going to be your area of specialization. And then, so this publication that you have will count very well for you, even going forward, because if you're going to become a professor of conservative dentistry, these are the publications that are going to be counted in your favor. So one of the things, again, in identifying an area to go into, will just be, oh, which area am I specializing in now? Should I just start focusing on this street? Again, this was the advice I got and supervisors were like, what area would you want to specialize in, even when you become a consultant? Start now. Other things that make people decide which research topic may be the national directive. I know sometimes you know that, oh, the government, for example, the time of COVID, the government, everybody is thinking about the solution to COVID-19. That may be one of the things that you say, okay, why don't I pick a topic in this area so that I will be able to fit into this goal. Currently, we talked about the WHO projected issues, particularly in Africa, where NOMA has been identified as one of the public health problems, right? That may be one of the bodies like WHO, those big organizations, government identify an area as the problem area. Many of the fundings are going to be diverted into that area. So it may be one of the things for you to say, okay, what can I do around NOMA? Because a lot of people, particularly the public health community, are looking for answers in that. So we talked about what area of interest. So maybe as an aside, many people come when we are discussing, say, I've been looking for topic now for the past almost 1 year. Instead of my supervisor should just give me a topic for me to go and work on. Yes, they say I should go and be thinking about my area of interest. I like anything, just so far provided that it can work. And I said, yeah, I can understand your frustration, right? But the supervisor is also trying to be careful because conducting research is not easy. You may get hooked, permit the word, and then you start blaming it on the supervisor who gave you that topic. But if it comes from you and it's something that you are interested in, those are some of the things that will get you through when you are involved in your research and it seems that you have in them can be quite useful. Now, the step two is to conduct a preliminary literature review. So now I'm interested in tobacco control. It's I need to read around tobacco research, at least in my own environment in Nigeria, understand what are the things that have been done, understand some of the areas where there are gaps. I think a little for people who are actively going to do this, it will be useful for you if you can lay your hands on systematic reviews that have been done. Imagine, okay, and I got one recently, going to work around orphanage, right? And then I just saw a systematic review that was published on oral health among children living in orphanages until last year. So getting that systematic review, I just went through the studies and I was able to identify, okay, this is what this one has done, this is what they've done. Some of them would even put the gaps in it for you to be able to understand these are areas where we are still lacking information and that we need to build upon. You look at the recommendations that they make in that. And immediately I saw it, first thing that came up was there was a paucity of studies among people in orphanages in Africa, particularly Nigeria. Only one study was put into that literature review, systematic review that was conducted in Nigeria. So even with that, I'm already building a case for that kind of study. So it's good to first do a preliminary literature review just to get a sense, and then it helps direct. Now, this is the area I need to focus on. So, and that's the next step. Now, narrowing your focus. You then need to narrow the scope because I mentioned it. You have said I want to work on tobacco control, but if you can't do that amongst everybody, do I want to narrow it down to a particular population group like I do? Again, because I went to literature, I saw the fact that almost 80 to 90% of adult tobacco users actually start during adolescence. Oh, so it means that if we can work on our adolescence, if we can prevent an adolescent from tendencies that they will never smoke in their life, if you can prevent them from during that age period. So for me, that is an area I should focus on. If we can get a solution amongst the adolescent population group, then that is going to be very nice. Now, another thing another thing that happened that also makes me focus it more, because if you can see in the example I gave, it says susceptibility to tobacco use. Because I then saw the different tobacco cessation programs that have been conducted in Africa. Most of them, if not all of them, were unsuccessful. They failed in preventing cessation. So in my mind, I was like, we know that tobacco use is addictive. So it makes it difficult for people to stop. It may be difficult for people to stop. Now, what can we do? What if we prevent them from even starting? And that was my susceptible came into play. So that these people are susceptible, but we are going to prevent it from happening. I hope I'm still audible and things are clear, just to be sure.
Yes, yes, you are.
Thank you very much. So now, I think I've given this example. So the next step now is to start being a lot more specific. And that was, I think I even got there already in my explanation to say, you now need to start asking this question. Who are the people that would be taking part in this study? So that's your study population. Here now, if you want to go to my topic, research area, research topic, research title, we are getting more specific now. So we are getting to a research title area if you want to start distribution. But I said here we've been just using topic to mean almost everything. So talking about who are you going to do this study among? What are you finding out amongst them? Where are they going to be recruited from? Is it Ibadan? Is it Lagos? Many times people just write. In fact, I review papers. I saw one review one recently from the US, and then just wrote so the US are. And but time by time I looked into the details. This was just one locality where the study was conducted. So again, that's not the role of the United States of America. When are you going to do that? How is the study design or something? Is it qualitative? So these are things now that you need to then narrow down on. And one of the things that has been evaluating a research is the people. So what does the people? I'm sure some of us are already familiar with this. Your study research topic or title should contain the population that you are to define. I've seen, I've reviewed papers where in the title they talked about children with cleft. But by the time I was looking at the details in the methodology, they actually interviewing the caregivers, their parents. But all the while, everything has been written about children with cleft, what they suffer, what they go through, and all those things, only to then find out to know what the mothers are thinking. So if we are not careful, we may make that mistakes. You need to clearly define, and it should show in your topic. If you are conducting an intervention, you have to specify what intervention that you are testing for. You can see the topic I shared. It was on the health education intervention. Are there comparison group that should, and importantly, what the study outcome is going to be? Are you looking at the knowledge attitude of this? Are you looking at their practices? Those should reflect in the study title. And then, of course, you must decide upon it while taking. When you've done that, you then refine, revise, and again, I put here, evaluate it against what you should have in a good research topic. Seek feedback, discuss with people. This is what I'm thinking. think it's okay. There are several, in fact, almost every time when I'm working with my senior colleague, sometimes we sit down together, we start saying, are you sure we should not change this verb? Or do you really think this is, sometimes we even go to the dictionary perception. Does it mean perspective? You know, those kind of things. So these are the times to revise it and be able to get something that you then say almost ready. But I must also add that many times this may even be refined over and over again as the work progresses. What are the challenges? Well, because of the, let's say, challenge of a better phrase, I use the word challenge. But what I'm really talking about, people have the concern of this work has been done. What is the new thing I want to do about tobacco use amongst adolescents in about Nigeria? This is the area that I want to come. But this one has public. Now, when you face such challenges, what can you do? You should, again, will I say think outside the box? Here I put combined fields. What about other perspectives to it? Yes, you can even decide to say, okay, many people have done this using a quantitative approach. Why don't I explore and now use a qualitative approach in addressing this issue? Maybe by the time I interview them, I'm going to get more detailed information as to why they even engaged in tobacco use in the first place. What are the effects of interventions that have been done? Why is it not? You understand now? That, yes, there's a challenge of a lot of work has been done in this area, but the solution still means you need to see where other views to how that can be done. I do have another example. I think I was talking about this. Yeah, I think it's still the idea of using a qualitative approach into it because, particularly in this part of our own world, a lot of the research that we do here or that has been done are more quantitative, give questionnaire, analyze with SPSS. I noticed that more qualitative are lacking where you interview, focus group discussion. So those may be the area that you get into it, and then you are able to overcome that. Again, we talk about limited resources. Yeah. So you want to do such a big work, uh, but resources the problem. Again, you can just for now maybe do a pilot. Another thing is you can yes, you want to look at tobacco use amongst adolescents in Nigeria, but you don't have the resources to go through Nigeria to sample adolescents. You can look at by the time people have done different studies in their own local environments here about tobacco use amongst adolescents in Calabar, tobacco use amongst adolescents in Ibadan, tobacco use amongst adolescents in Abuja. By the time you do a systematic review, pull all this together. In fact, if you have the chance for a meta-analysis, you can then report what is tobacco use amongst adolescents in Nigeria. And again, I have an example of that study that looks at some predictors of tobacco Nigerian adults, and I think it put it at about 10.6%. Because what did the person do? The person just did a meta-analysis of all the small studies that are being conducted in Nigeria, pull this meta-analysis together, reanalyze it and got what? The value for Nigeria. So resources, you have to think outside, look at how you can overcome such potential difficulties. We have options of secondary data are available. Know that again, if you're talking tobacco now for Nigeria, it's been a long time since they carried out the global adult tobacco survey, that was 2013. Another one will be done now. But what I'm saying here, not to be too specific, is saying you can potential solutions even when we talk about when resources are lacking. And this is also what gives room for collaboration. So you can then decide, okay, now let's collaborate. There are some things that are not available in your facility, but others to it. I work with you may, or people here may also know him. I remember Kende Kamodi, who finished from the University of Ibadan. We conducted a study on adolescent tobacco use in Nigeria, sampled from populations across the country. What needed enormous resources, but one of the things, why don't you collaborate? Okay, there's somebody in Benin that can work around those in that area. Let's collaborate with you. You also bring together, get some funds to get questionnaire, administer, collaborated with people in the north who was having, and by the end of the day, at the end of the day, we were able to come up with something and we delivered on that. So I'm saying that yes, this may be a challenge, but you can also overcome it and design your study, including the topic. Okay. Choosing a research topic, we have said, does this interest you? It has to interest you. If not, you may have to change it and then go over this process again. But if it does interest you, then the issue is, does it answer a specific question? Is it focused? That's the point. If it is not focused, then you have to narrow it down, add time context, other cultural, like I said, just make it narrow it down. If it is, yes, fine. Is it unique? That means is it original? Is it bringing something that has not been reported over and over again? If it is, then some questions are open, then just go for it. But if it is not, then you say it has been over researched, no problem. Are there other things that you can do? Are there new aspects into it, perspective? Can you the methodology? Again, I've got the work I did on susceptibility. I think somebody had reported something in Nigeria, just one person intervention, but I noticed that it was a quite experimental, just a before and after study. And that's why I said, no, this time around, that's not strong enough. Why don't you do a randomized control trial? And that was my justification. And again, I used that to develop formulate my research topic. And it's been wonderful experience since then. So I think that's basically on the first leg of choosing a research topic. I think I may just go to the next. Probably we'll take questions, contributions after. I hope that's fine.
Yes, Dr. Fabule, that's fine. Thank you.
Yeah. So now the is maximizing research funding opportunities. So and conferences. Many times we like this and it is good. I I want to say maybe loosely that I've met quite a number of people, students especially, that come to me and say, "Oh, there's this call. I want to apply. I want to apply for this." And many times they they are yet to have a sound without that foundation. They just showed interest now because they've seen the funding opportunity. Is that wrong? No. But I prefer somebody that already build a good research foundation. And thank that, I think that's why we say kudos to the organizers of this program. Have a good research foundation and then start looking at how we can get funding. That's one. Secondly, I must also say that I'm one of the people that even till now use our own personal money to conduct research. I've spent millions of money to conduct study. And we even think that we are doing good, but it's not necessarily the best. Of course, if there are no opportunities, it's still good that you find a way, because by the time you do studies, it increases your chances of getting funding. But the part that stopped me was I attended a program then several years ago on grant writing research, and this was delivered by Rob Murphy, is the guys in NIH when we are talking about this issue of there is sit on grants to give out. So part of the exercise was now for us to look at our CV, the NIH basket, filling it. So I put mine and then we used it and all those. But in all of what my CV, there was no grant or nothing there. And he said, "Oh, this is very weak. Getting a grant, it's easier to get more grants when you've got." And I wanted to boast and say, this is self-funded, they will look very kindly at it. This person is even using his money to do. Say, no, it doesn't work that way. They prefer somebody who has, they probably prefer some grant seems to be in a good light. I think that was the point we got from that message. So what I'm trying to say, not to confuse anybody, is that it is good to get grants. It is good to go for grants. And it is better to say your work has been funded by so than to say it has been self-funded. In fact, we walked away from that program, the fourth of us that attended, to say, are we sure we are not going to start funding ourselves? To say, okay, let's pull funds together and call it Association of Resident Doctors Research Grant. And then this one will win it. Then this one will win it. So that at least we'll be able to have in our CV that at least you have 1 gram before, even though it's our money being put together. Just so they like, but I hope I'm trying to pass use of research grants and funding opportunities. Now we will explore ways of to secure research funding and discuss strategies to maximize benefits of attending conferences. Yeah. So this is about research funding. So what are the different types of research funding? We have the ones that the government usually give out. In Nigeria, for example, many of us may or may not know the Set Fund Grant is the tertiary education trust fund where they give to lecturers actually. So this is for lecturers, tertiary people in tertiary education, in tertiary institutions, public grant is from the US government, and again it's for fund research. So just to say that we have grants funding from government, we have funding from non-governmental and international organizations. We have the Gates organization, WHO. Bill and Melinda Gates funds virtually all tobacco control research in Africa, if not all. Bill and Melinda Gates Foundation. I think, well, it can be all, but significant proportion of money that goes into tobacco comes from that foundation. Then I put in the society-based funding opportunity that many don't even know. And they offer, they have a better chance, I think, with that. For example, the IADR, we have that's the International Association of Dental Beneficial and Oral Research, right? IADR, we have the international, we have the national body. Bodies like that, sometimes they give us some small grants. I know I currently have a small grant from IADR Nigeria in consultation or in conjunction with Colgate. I've gotten a small grant. An NGO, I remember them 4 or 5 years ago, $5,000 grant. Again, it's just an NGO. There's no noise about it. It's not big. And I think for us as early career researchers, these are maybe areas for you to first start from. It's not the NIH grant. NIH grants, you have tens of thousands of people pulling for it. These are big guys. But remember when I said, when you start, you win this small grant. Those are the things that will convince them, these big bodies, to give you the bigger grant. Sometimes you have the university-based funding opportunities. It's just for members of that university. I've been in collaboration with some people in the US, and as faculty, you have a small grant to assist the students, and you can just pay into it. And what do we have here? Yeah, sorry. Yeah. So this is the one that I mentioned. The idea for Great Research Award. It's very quite small, but still useful. At least it's better than it would augment the money I would have spent to conduct the whole of the research. Now, key consideration for funding application. Please, we need to ensure that it's aligning the fact ideas with the funding priority. Many times people just apply. Before you apply to an organization for funding, it's good for you to go and read about that organization, find out what is important to them. There are some organizations that, in fact, some don't fund cross-sectional study. There are some who don't fund health education intervention. I've read for some, when I look at the specific details, you start finding that, oh, they don't fund this. Some are more of, will I say, activity-based kind of maybe there's things that to me they are conducting an outreach kind of funding. So the point is, it's important that you look at what are the priorities of those funders. And one of the ways, apart from when you reach through, I think you should be able to find it maybe on their website, on the details of the call. If you don't find it, you can also look at what kind of study funded in the past. When you see those studies they funded in the past, it gives you an idea of what is the area that these people are. So this is one key consideration part for when you want to apply for research funding. Again, another is to look at talking about aligning the research and importance of impactful problem statement and clear objectives. I think this one is clear. It has to, you have to present a compelling situation, be specific as to what exactly you are going to address, and be sure that it's fitting into again what those people are looking out for. Your budgeting, the methodology, the expected outcome needs to be solid and aligned. You see, many times people see budget is just the money. No. The purpose of the budget is not just the money and who is going to spend it or what you want to spend it for. Budget is also useful to be able to test your understanding as to the whole process of this study. So you want to conduct a study where you want to do an intervention like the one I use, educational intervention on to improve their tobacco related knowledge. In your budget, you don't even have a session on data collection, questionnaires to be administered, or is it poster you want to develop? The funny point. So if when you look at somebody's budget, it also gives you an idea that does this person really have an understanding of the whole research process, what money is going to spend, what activities rather that you're going to conduct in getting that quite important. And these are some of the things that funders or the assessors are going to look at expected outcomes. Funders will want the expected outcomes to be clear. Oh, we are going to produce a book from this. We are going to produce a poster. We are going to develop this. We are going to get a policy document. We are going to get, those are things that the funders, because at the end of the day, they will also want to go and boast and say, okay, these are the things we're able to achieve or get as output from the things we have funded. Um, Against strategies for early career researchers. Now, I have put early career researchers into inverted commas because actually, if you understand the definition of early career researcher, so I was some years ago was going to apply for, let me even try my hands on NIH grants, and then I saw the ones that are for early career research. So I had to go and read deep their definition of early career research. An early career researcher to them is somebody who has completed the terminal degree. And what's a terminal degree? A terminal degree is a PhD. So when they say funding early career researcher, in their head, they are seeing people who has completed their PhD, maybe within the period of 5 years or just about to complete. But anyway, as we are starting. Now, I think we should leverage on mentorship for guidance and funding. Many times, that would be my advice. Look for mentors, people who already have a good understanding. Some of these things about the area of focus, this one is appropriately securing grants. In fact, sometimes even having them as part of the team can improve your chances because again, assessors are going to look at the capability, the capacity of the person who is requesting for $20,000 to conduct a study. There's this particular one that we have gone through. Unfortunately, again, I work with a group, and the first time was rejected. The second year we applied, again rejected. And when we got the feedback,
Yeah. Okay, it seems we lost Dr. Fabule briefly. So while we wait for him to join, we can start to put our questions in the chat box. So for all the sessions we've had so far,
sorry.
we can start to try. Okay, welcome back.
Oh, I didn't know that. I didn't know.
It's you just dropped off the call less than a minute.
Connect. Anyway, but while it's trying to connect, I think I can go on this. Okay. So again, I think I've mentioned to say for us to start from small ground. So on your CV, even if you don't have a thing as principal investigator on your CV, or at least you have an investigator. You are a co-investigator. It also counts on a funding opportunity. So even if you are not the one that has directly won it, but at least you are part of the team, in having there that you are and co is also at least also good for you. That's yeah. Building a track record with publications and pilots. So this is important, and this is where of even self-funding your research may come into play. You need to build a track record. Now, how do you build a track record if you have not done it? Now, how do you do it and you don't have funding for it? It's okay, but it's not wrong if you can at least on your own, at least do. I tell this, even if it's You have collected data from 50 people on their own opinion about clear. Even that is the case. Or should I send it to, if you can still hear me, should I forward it to you and you project? Because
Oh,
this
okay, yes, yes,
presentation
we can do that.
is not coming. Sorry, so that just a moment. Yeah, so have that track record. You can just, if you just do among 50 people to say, okay, what's your opinion on cleft or what is the psychosocial effect, blah, blah, it's going to count in your own favor by the time you want to then maybe get uh, funding, we apply for a public cleft related study, things like that. So the advice is just make sure that you have a track record. There's a colleague of mine, I remember again doing residency, we just start, okay, oh, what can we do? Look at the oral health indices of people with HIV, and then, in fact, at the time, ARD was giving, just supporting people with small grants. And how much was it? I think it was 50,000 naira. And we applied, we got it, and we're able to do our work using that. Now, the thing is, now this particular colleague has gotten a lot of grants, fellowship now of people, and I'm one of the major, she has at least, she had at least done something useful based on what we had, what we did together. So I think this, have you received it? Not yet.
No, not yet. Are you sending via WhatsApp or to my mail, sir?
Yeah, I think, let me see if I can try about,
Whichever one is easy. You can send to my WhatsApp.
okay, okay. The network has been very poor.
Yeah. Yes. So participants, you can go ahead to drop any question you have in the chat box. It will be taken after
Yeah,
the session.
okay. As it is,
Yes, I've gotten it now.
okay. Is it when you're ready? Yeah. So common mistake that, that has been to advise that we try and avoid. Again, to speak to poorly articulated research questions. And many times the research questions, the study objectives don't even align with technology. Again, I mentioned unrealistic budgets or timelines. And I don't know who this may be useful to because I think the same question was it last year, where yeah, this was a small grant, and then but what I wanted to do was fight a lot. And I felt, okay, whatever they are going to give, I will do my budget to reflect the total work. Let's say assume it's going to be 5 million naira. But the funding is just a million naira that I'm going to do a budget of, but put there that 1 million that you are going to give is just going to be part. I'm going to source for the other elsewhere. And I was answered to say no. If the funding call is 1 million naira, then just do a budget of 1 million. Remove part of it. So that's where the issue of pilot then comes into play. You say, okay, just make sure that it fits in into what has been said. The other part is the unrealistic timeline. So this whole project is supposed to be for 1 year, and then you are designing a study that says you are going to collect baseline, intervene for several months, and then follow up for 1 year. By the time you are completing your work, it's already 2 years. And this funding cycle is just for 1 year for you to be able to deliver. You see, by the time you see that, sometimes people don't even read the guidelines. The kind of work, are you projecting already? Doctor, sorry, am I, can you hear me?
Yes, yes, I can. Can you see my screen, sir? Hello?
Okay.
Okay, so it seems network issues might have locked Dr. Family out once again. So while we give him some time to join, please remember that you can go ahead to drop your questions in the chat box.
Hello, can you hear me now?
Yes, yes, welcome back.
Ah, so sorry. The network has been really poor, but I think we'll get through it. Okay, so no, go back, back, back. Yeah, I think yeah, so next slide now. Next slide, next slide. I think I'm speaking about the next slide, next slide. Yeah, I was talking about the common mistake. Yeah, that's the where our research should actually align with. No, we are going too fast. Yeah, so uh maximizing conference opportunity. So
Hello, sir. Is this fine, sir?
yes, I'm trying to. I think I'm about rounding up though. So if it's possible, maybe I should share it so that it goes. I think I'm back. You can unshare. Hello. Hello,
I can hear you, sir.
you can hear me. Okay, and so yeah, I think we should. I think we will get through this. So, maximizing conference opportunities. I said we should learn. Yeah, why conferences matter. Networking with peers, mentors, and collaborators for you to network. I would advise if you have the opportunity to let attention. Many times we are just here in our own distance. There's a lot of things happening. There are a lot of opportunities. But if you don't go out, going to the likelihood that you'll be part of that communication is limited. So if you have the opportunity, please attend conference because working. It gives a platform for you to build connections with experts, peers, meeting potential collaborators, and open doors for joint projects, future funding opportunities. And then there's the opportunity for the SRNC, Society for Nicotine and Tobacco, have what we call the Let's Have Coffee session, whereby you even meet with mentors, have a discussions around, they will pair you together. Those informal discussions also create bonding, and then it's that's where that person goes back to his or her country, and then they want to do something in Nigeria, and they say, oh, Francis is there, as this is there, we have this work. What do you think? You understand? So that's important. Again, why conferences matter. It of course gives you the opportunity to showcase what you are doing, your own work as it were, into that sense, and enhance your visibility. Because imagine if you have projects, they have conference abstracts published, and so on and so forth. So it's important. Now, it also helps you to learn about new development and funding for. So I was at a conference last year, and then we were talking about, the last time we even this was this award house. We got very few applications from Africa. They had this special like travel award for 10 people from low countries to the front. But they said they only got very few applications. So I was at that gathering, they were discussing. I was like, really? You didn't know about the people you see now? You say we can provide them available. So, but for me being there, I go that information, and then we were able to tell the story that things like that.
I'm hearing you. Anybody there?
So, apologies to the family. Apologies to everyone. I'm back. It seems it was my time to be afflicted by network issues.
Dr. Fabulous, sir, you are not audible enough.
I'm not audible.
Okay, it's better now, sir. We're not hearing anything earlier. It's still bad, sir.
Yeah, is it better now? Yes, it is.
Yes, much better, sir.
Oh, very to travel grants and then apply for these awards. This is an example of a travel award I got to attend the Society for Nicotine and Research, nicotine and earlier in the year. Some conferences also have reduced registration fee, maybe for students and attendees. What you should do is when you see that conference, go and read the details. Look for areas of award. IADR, for example, there are several travel awards or different awards that are associated with IADR international. And even look at that, you can see some are newcomers, different ones, just to say, look out for travel grants. The other is making the most out of conference attendance. Now, when you get to this of your presence, you probably make sure, poster presentation, you are going to stand by your poster. People, there are a lot of, look at this number, this is 152. I'm sure about, you can see under here is also information about the author, which I put there, my contact address, my email, for collaborations or more works in this regard, then let's do it. Practice. Yeah, so that slide was just to show an example of a poster. Again, this was presented, well, not by myself, at a conference in the US. Was it in September? Now, scheduling meetings with potential collaborators. So one of the things is, you see this person, this man up here, I already knew that I was going to see him at that conference. We had a brief exchange of email to sell an idea to him on that we can do together. I already, before even attending, went to check his previous works, look at what he does. Interestingly, I saw that he also does some things around sugar sweetened beverages. So by the time we saw, the conversation was so smooth. We were talking about, oh wow, you understand that kind of thing. So be intentional. The person down here again was the mentee mentor coffee break that we had. So we already had the connection even before the conference. So I already went through her profile, saw the things that she was doing, and then had my idea that I want to pitch to see that we can work together or can collaborate, even provide mentorship or guidance. So what I'm saying is that identify identities you like to connect with even beforehand, if that is possible. And then while you are there, you see, when you are there, you are meeting somebody immediately, you are going to what's your LinkedIn account, connecting with them immediately on LinkedIn, send them a message. When you are together, it's even better. Then actively participate in the discussion, the questions and answer. Attend sessions relevant to your interest, participate in panel discussions, engage with presenters during breaks. Just discuss. But of course, while it's not just talking for talking's sake. It's also important that you talk sense, right? So it means that you should be prepared beforehand so that by the time you are meeting somebody, by the time you have a two conversation, this is a potential collaborator that you can have and have discussions with. Now, after the conference actions with the new connections is important. So this is something that I do, and I think you can also do. People are meeting many people at conferences. They greet and smile at you, but the truth is that you may not register. What I do sometimes is, okay, can we have a picture together? You take a picture, good. I get your email address. After the conference, you send an email to the person attaching the picture that you took. You attach the picture that you took and you say, oh, so with that, the person, at least this is not a scam. And then you can say, oh, that's one of the things that, well, if you may consider doing, or something that I do, or immediately you send that message on LinkedIn just afterwards to keep the conversation going, keep the link together. Then, of course, when you get back, share insights through reports, your blog, people write, you will have seen that on LinkedIn, where their experience can have seminars and leveraging on lessons learned for future funding projects. There are conferences I've gone to and I gave me an idea as to, okay, this is the area of funding now. This is where people are looking now. This is what they're talking about. And I then walk around and see what I can do in that. Another common practice at conferences that you can engage in. You can see here, these are the tags of people. So you just say, excuse me, can I just take a picture of your tag? Introduce yourself. Now with this, I then go back and find out more about that person. Manumato, oh, okay, now go online, read about what they are doing, and then we can then take the conversation afterwards and send a message. So now I know the person, I know the kind of work they are doing, and I know, okay, maybe this is something that I can pitch with them. This is an area that I come in to do. Again, just talking about conferences. The conference I attended, the SRNC conference I attended, was where I saw Professor Fashiru. Of course, is somebody that I know before, I heard of. Let's just put it that way. But we saw at the conference, and then afterwards, we followed up, and then he told me about the World Congress on Lung Cancer. I don't even know anything about that. There's an international association of lung cancer, whatever. And then he told me about it and he said, okay, is that something that we can do? In that regard, he's a member, sent me a link to put in. Again, I saw that there are quite a number of awards. I applied for the award. He stood as a sponsor. Of visa. So he presented it at the conference. But again, what I'm saying is that this started as following the conversation up at the Edinburgh, took the conversation forward and look at what I don't even know this association existed before then, but now I'm a member and got a full membership for another 1 year as a result of this. So I think this is practical tips. Funding and conferencing resources, there are different databases. You see, there are different, sometimes you see, there are some, or there are some opportunities that people, they will send around. Sometimes I will register for them, not really because I'm interested in that particular event that they want to hold, but such that I can get into their list serve, such that subsequently, when they have other things, they just put it on their list serve, and then you get this information. So if there are funding opportunities, again, you get from the list serve, or go to check conference websites, and then saying, then there's this thing about NIH that you can sign up to, and you start getting emails, informations about conferences, about opportunity funding opportunities. Effective time management is important. Many times we rush. I'm also in this situation though. I'm working on it. The deadline is today. That's when you start putting up your abstract, your application. Many times it's better to set the time. Then seeking peers or mentors review. I think I've mentioned this over. Again, it's good to utilize tools like Grammarly helps Grammarly helps to look at your, grammar when you write. And even the free version can still help you pick the basic mistakes. I use Grammarly. And the thing is, even though it's unpaid, but STE, there's helps identify some typographical errors, which makes life a lot easier. If you are able to pay for a full version, it can even suggest editing, how to polish the English and the grammar and the like. Zotero is what you use for referencing the MS project again. So what I'm saying is that also learn to use these tools to help you present for a good proposal. Build it, highlighting your research skills and achievements. I had to build my profile last year on LinkedIn because there was something I applied for. I applied for that position. And I went on my LinkedIn, I see somebody checked your profile. It was somebody from that organization where I applied for something. So so people can come, this is a place that people can come and check and find out. And at that time, there was nothing in my LinkedIn profile. So I had to start putting things. I say, earlier in the year, in January, this was in November. In January, I seems to be the professional social media, if you want to put it that way. And quite a number of people want to visit there and then see what. Yeah, open access publishing. This is straightforward. So because of the time, open access publishing is a model of scholarly publishing that allows free and unrestricted access to research articles online. So they have read and use scientific publications, materials. This is more about journals now, trying to say, okay, there are some articles you want to access, they say, oh, you have to pay for it before you can read them. Those ones are not open access. But the ones that you get to and then is easily available, you can download it, you can open it, you can read it, wherever part of the world that those ones are in open access. But the issue is that somebody must pay for it. The review process, the editorial process, the offices and co cost money. So who is paying? And that is what determines the types of open access that you have. The gold open access, where you have full access to readers have full access upon publication of that work. but it's oftentimes because the researcher has paid for it, has paid the article processing charges. So you can then see it and use it. You publish your work as a researcher, but you are allowed to then post it can be maybe the final version, but not the published version of that work on some repositories or some platforms. Sometimes they can say, oh, after a period of 1 year that you have published with them, then you can then make it available. So some people will then go to their ResearchGate account and then just make it available there. So that is like what we call the green open access type, whereby after a period of time, then you as the researcher can make it available and people can download and get it. Then you have the hybrid. There are some subscription journals that also provide open access opportunity. The diamond open access is where both the author and the reviewer has not paid, but institution that has paid for it. For example, any work that NIH has sponsored said must be made available. So it means that NIH is going to make sure that that published is freely open access available. You have some consortium, you have Qatar, even institutions can make that payment on your behalf as part of the arrangements that they have with that journal. What are the open access? Of course, it will mean increased visibility and citation rates because a wider number of people can access it, they can read it, and then that's when they can cite it. If they can't read the full article, they are not expected to cite. Dissemination of findings now because, like I said, as it's published, it's available. So it means that people can see and then make use of it immediately. And that counts very well for the researcher. So global equity, the idea is that particularly those of that it's not good, it's not right. So we don't have access to these things and research is being done. Imagine when they even done the research in your country, even you are part of that, and you don't have access to see it after. So sort of like an equity promoting research from underrepresented regions, whereby at least when they have access to this, also encourages them, improves their chances of conducting more studies and essentially equity. And for the society, if your research is openly available, it means that even practitioners, dentists, surgeons can quickly see that interesting new technique and then they can apply it and use it to the benefit of their patients and indeed for the society. Well, in summary, I think what I just said, again, unfortunately, we had a lot of network issues, is the research topic and the importance of getting a good research topic, the steps in which we can take, funding opportunities, how to make the most of attending conferences, and then open access journal. I basically want to thank everybody for your patience and for listening to me. Thank you very much. It is Initiatives International.
Thank you so much, Dr. Fabule. That was a packed session, very, very packed. I learned a lot, so many things to note. I mean, for me, I particularly loved the breakdown on open access, types of open access publications that we have. So many things, the practical tips, you sharing your own experience. Thank you, Dr. Fabule. So now we'll just move to the questions and answer section, and that'll be moderated by Dr. Shumi Victor. So Dr. Shumi Victor, are you ready for us? If you are, over to you.
Thank you very much, Dr. Fabule. So we have a couple of questions in the comment section. Flourish Anointed asked about 4 questions. So I'll just be reading them out. So I guess we'll just take them one after the other so that we won't miss anyone. The first question is, how do you navigate to add to the body of knowledge when a lot of research works have been done in the area? Dr. Fagbule, sir.
Yeah, I didn't get, did I say that again?
All right, sir. I said, how do you navigate to add to the body of knowledge when a lot of research works have been done in the
In that
area?
area. Yeah, thank you very much. I think I tried to touch on that in this presentation. You have to be innovative. So and I said, let me give an example. Example is tobacco use amongst adolescents in Ibadan, Nigeria. A lot of work has been done in that area. But what else can I contribute? Again, when I look at the literature, I then see that most have been done but long time ago. Maybe the last time was like a decade ago. Then, yes, I can do even the same thing again because 10 years is a long time. Is the picture still the same thing? Do we still have the same issues now on tobacco use amongst adolescents? That's an idea. Yes, work has been done. Of the works that have been done, many of I wanted to look at the effectiveness of intervention on susceptible. So reported something similar in Lagos now. But I looked at it, the person did just use a quasi-experimental study. There was no control group, there was no follow-up period. So it's an after study. So even though I'm doing the same thing, but now I am changing the methodology to involve a randomized controlled trial with a robust methodology and a follow-up period over a period of time. That is something new. Body of knowledge, which is literature, see what is missing. So the advice I also give is this, not just that's the standard, the ideal way is have a literature matrix. When you have a literature matrix is what are the common studies on this area, on this issue. When you put all of them in a spreadsheet, that means at a glance, you can see what's the pattern and you can see where you can come in. That is the advice I'll give. Thank you.
Thank you very much for your response, sir. To the next question, the person said that in a scenario where there are no related literatures and nothing has been done in that particular research area as regards a particular location, how can one start at that point? Also, I think I will just take it with the next question, which says that, does location affect the formulation of research topic? Did you get that, sir?
Okay, so yeah, the question is that nothing has been done on that work, particularly in that particular location. How do you address that? And then the situation where when you say, okay, that.
The second question is that, does location affect formulation of research topic?
Right?
Yes, sir.
Okay, so let's start with that one. Many times when people want to justify, they say no study in Ibadan on this smoking amongst adolescents, factors associated with smoking amongst adolescents in Ibadan. So because of that, I want to do it. But they've done it in Oyo, they've done it in Ogbomoso, they've done it in Lagos. That may not be strong enough. And that is the common thing that we often do. Before that will be accepted, you need to let us know why Ibadan is different from those other places where the work has been done. Because we actually literally cannot do every study in every city, country for us to get an answer. Do you understand? So when a study has not been done in a particular location, but it has been done in similar locations, it's hard for you. And this is a typical example that I give people. So my colleagues particularly are saying, we want to compare, let's say, a restorative material, composite restorative material, the effectiveness in Nigeria among patients attending University College Hospital is maybe it's the same. Is it not composite? Has it not been done in the people who produced it are researches that has done and has shown that this thing is effective? It can last well for over 5 years. Just saying it has not been done in Nigeria, for me, is not a strong justification. However, this is the advice I will now give to you, which is saying you need to first now define why Nigeria is different from United States of America. So I can then say the diets that we eat in Nigeria are quite hard diets compared to Western countries. Now, understanding that this composite material is going to be used for chewing food, and that can have a significant effect on how it can last. Yes, it has been done in Western countries that have a different diet from Nigeria. So because of this, I want to do this study here in Nigeria because our diet is different and it may have effect on the effectiveness or the success rate of this composite material. Now you can see, yes, I have justified the work doing it in Nigeria, but I didn't just justify it by saying, it has not been done in Nigeria before, so I want to do it. I've explained why it is important to do it in Nigeria, why Nigeria is different from the other countries that has been done before. So that is what I'll say on that. Now, on the one of it has never been done and sometimes I also still have students and say, maybe the reason it hasn't been done before is because it should not be done. You know, that's another thing. What is the usefulness of the research? It's also important. Have you done any research that says how painful is it when somebody slaps you sitting down compared to when you are slapped standing up? No, we have not seen that research before, but that does not mean research does not make sense doing it. So just saying it before, again, it should be done. Now, but it has not been done before. Sometimes that is one of the reasons why we even use the qualitative study. Where we use that opportunity to just to get a sense as to what is happening in this area. So yes, if a study has not been done before and there's a good reason for it to be done, then even the qualitative research where you interview people, you can just get about 10, 15 people, just interview them, speak to them about that issue. And from what will start coming out, from what they say, you start building up on it and getting information around that. Again, example I'll give, the work I presented was the perception and compliance of Nigeria. It's something that has not been done, actually. So even for me to create question, you see other questionnaires, they say you can build question from. There's almost not conducted people selling tobaccos, the women in Bere and Co, interviewed them, then started getting in around these conversations around that. So yes, this is what I think the way you can go about it. I hope I've answered that question.
Thank you very much, sir, for your response to the question, sir. The next question. So sorry for okay. He said that I am working on a research and it is my first time. My topic is assessing the oral health status and treatment needs of commercial bus drivers in Kano metropolitan area. The research is geared towards social determinants of oral health in the community. What will you do with that kind of topic, sir? So it's basically asking that how better will you structure the topic? So he's saying, what will you do better with this kind of topic? The topic is assessing the oral health status and treatment needs of commercial bus drivers in Kano metropolitan area.
Okay, so the thing is, the first question we should even ask is, based on the topic that has been designed and what the person really wants to know, do they align? The person said he or she wants to know the social determinants of health, I think, but you have conducted a study that looked at the oral health status and treatment needs of bus drivers. Social determinants of health has come out in that topic. That's to start with. So, if we want to understand the social determinants of health, you come up anyway, just because not to, is probably when you then look at what are the predictors, the social predictors, the age, gender, and that's regarding their status. Yeah, so I'm not saying that's not possible. So maybe I should rephrase what I said earlier. But this person this is just your first time. What I will say is you should have a supervisor that have a good grasp of methodology and design. I'm all careful when students or any new researchers are working on oral health status. That sounds to me like you are going to examine their oral health. So oral health examination is going to take place. Because it's not taking place, then I'm not sure you can say this is their oral health status. That you are going to look at indices. We want to check DMFT, Simplified Oral Hygiene Index, the examine. Now, I, as a researcher, know what we call the importance of examiners' reliability. Is it going to be is it just one person who is going to look at the amounts of all these people, or there are many examiners? If there are going to be 2 or more examiners, then they need to be trained and they need to be calibrated. So what I'm saying is, this is a nice research. I applaud you for getting somebody who is vast in similar work to be able to guide you through the process. You have seen that quite a number of what I've put here, say I won the travel award, this, they won this. If the methodology, it's not just about just go and collect data. No. Good research is not just about just go and collect data. How you collect that data is arguably the most important thing. If a good methodology, when the result comes out, people will just start faulting it. So not to waste time on answering this, I think this is a good study. it is workable even with the issue of social determinants, because now I see you can use those statistics as potential predictors of their oral health status. But examination is a tricky part. It means that you need to demonstrate that training will be done and calibration will be done for those who are going to examine. So get somebody with a good understanding of these details, and I think you should be fine. Thank you.
Thank you very much for that comprehensive response, sir. When you were answering the questions, someone else, Henry Lodson, dropped his own question. So I'll just take that quickly. He said, as a fifth-year dental student at the University of Benin, I have developed a keen research interest. Unfortunately, my college does not facilitate student-assisted or initiated research. To enhance my knowledge, I have participated in numerous online research classes and webinars, which I find helpful. However, I believe that actively taking part in research would significantly reinforce what I have learned in these classes. How would you advise me to pursue this interest?
Yeah, thank you very much for that. What's just to answer simply, I want to appreciate you, congratulate you for seeking to different online classes. That is, for me, one of the major things that actually also helped me in learning. In fact, it became a problem. Anything I see on research methodology, I will apply. So almost impossible to even concentrate in all of them. Now, practicalizing it, what I advise is wherever institution you are, there will still be people, senior colleagues, conducting research. Take your time to find out about them even before approaching them. So what I mean is, you can type their name on Google Scholar. You can type their name online. At least Google Scholar will bring the research they have done. If you don't know personally, you will see the kind of studies they've published. If you see the ones that, oh, this is nice, this is an area that I like, you then approach the person and say that, oh, I would like to learn, get my hands dirty in research, work with you, and from there, you start gaining experience. I doubt anybody would push anyone away that comes to meet genuinely that I want to work, I want to get into practical nature. And many people have come to me, but sometimes when I look at it, I see that this person is not really the person is interested in. It's probably so that later you can write letter of recommendation. Is what this person is actually looking for, not ready to work. But you see those who are genuinely ready to work. So again, maybe I should quickly drop this here. Some people too will say, they say go and collect data. And they're just using me for data collection. Because of that, you'll be running away from that person or that researcher. Please don't do that, because it is not what I did. Anyway, let me just put it, and I think you can, is somebody says that, oh, we have this, go and help me collect this also data. I say, among secondary school students, I say, okay, that's very good. I then say, just having them going. When I administer that questionnaire on the person's related quality of giving them 5 questions on their interest to study dentistry or their tobacco use status. So that by the time I finish, after collecting the data, I now have my own 5 questions that have also been able to gain, right? So even if the person does not involve me in the other work in writing and co, at least I know that I have small data now on my own that I can also use for. Do you understand now? So it's a good mindset that you have. Identify somebody to faculty, read about their works before going to meet them. because that is also key in our own area here. If you go and meet them and now you see that there's almost nothing, it's not what they do is not related, you are almost hooked. If you now go back, if you don't go again, it now looks like this, you see, you're not a good person. So find out about them before making that step, taking that step. Thank you.
Thank you very much, sir. Thank you very much for your responses, and thank you for the origin, the hints on how to actually at least get something for ourselves, even when we are trying to assist our senior colleagues in data collection. I will now be handing over.
Exactly.
Yes, sir. I will now be wait. Okay. If there are any other questions, just indicate if you want to. If you don't want me to read it out, or you just want you want to ask it yourself, indicate in the chat box. Within the next 5 seconds. So if there is none, I think I will just hand over back to Dr. Aziz to continue with the rest of the.
Okay. Thank you, Dr. Shomoye. Thank you, Dr. Shomoye. But I think we have one. Dr. Babalola, please go ahead.
Yes, thank you very much, Dr. Fagbele, for the wonderful presentation. So my question is this. It's the end of the year and we are going to 2025, and I guess what advice can you give, or what opportunities can people look out for? What conferences, what abstract? I mean, this is the time to re-strategize and plan for the new year. So I have two questions. The first question is, for 2025, are there some high yield or high impact conferences or abstract presentations that you would encourage people that are just starting to look into, or to have their eyes set towards? That's my first question. My second question is that regards writing and publication. Would you advise people to delve into original projects like data collection, or maybe build their hands through writing reviews, just building their writing skills, maybe through narrative reviews and the likes? Thank you.
Okay. Yeah. Thank you very much. Yeah. So I don't like to deliver bad news, but against next year. So, we also have networks and circles. I'm going to talk about the ones that I am thinking that I walk around, right? Which I have identified. First is the International Association of Dental, Oral and Craniofacial Research, IDR, that I spoke about for Nigeria. They have just completed that, I think, last week or now. But the one for the international is going to take place in June. I think between June 21 to 23, thereabouts. The abstract submission will close June 4. Now, for people that still want to apply for awards, there are still some travel awards that are still available by the January 24. So maybe I should say this generally. Commonly, you see, most of those conferences, they have, will I say, two deadlines. There's a deadline for people who want to apply for maybe an award. So if you want to apply for a particular travel award, you have to have submitted at a particular date. But the good thing next year is that there are still a lot of awards that you will only close at the end, which is January 24, 2025. That is one. Secondly, again, I walk around tobacco. So I know that there's going to be the SRNT, which we have spoken about, That one, I think, is taking place in New Orleans next year. And currently, we have so there's this general normal abstract, and there's what we call the response. They have the rapid response. Now, like if you still have something, bring it in before the next 1 or 2 weeks. I think that abstract is still open, and I think it should be open for a few weeks before it eventually closes. What is people who want to apply for awards? I think that one has closed. Yes, it has, because I even applied for one that did not come through. They gave me the notice, was it 2 days ago? Yeah, so that one, SRNT conference, again, is where I work. The other one is now next year. This one, they don't do it I think it's every 4 years. World Congress on Tobacco, and it's taking place in Ireland. The abstract stuff just started recently, so it's still on. And so people can check it out. I think it's World Congress on Tobacco. You can look, but it's by the union. It's in Ireland, and it's in June next year. There's the multinational MASC, MASSC, Multinational Association on Supportive Care in Cancer. Supportive want to go for award. I think it's going to be maybe tomorrow, if it has not closed already. People want, and in fact, they even encourage. So it's cancer, right? And again, why did I get into it? Because with oral cancer, you can also come, if you're a dentist, I can also come in there with tobacco. It also aligns with that. So theirs is you can check it out because they were saying first timers, if it's travel grants or waiver of registration fee, the likes like that. So please, you can check that out. Then we have the one that I mentioned now, World Congress on Lung Cancer. It is going to take place next year, but I think it's in the US again. So you can check that out. I'm not even sure the abstract submission has started, but please do check and be able to note. Any other conference that I have in mind? Yeah. The people, those of you in the US, I think there's the APHP. That was the one I sent this. Let me see. This work was, yeah, this one. This abstract, APHA conference. That's Association of Public Health is it practitioners. Yeah, this one was in October. So that means the next one, so most likely is going to be in October. Again, because I have a collaborator there, that's Mahmoud, presented then. So I think this is also another one. So, well, apart from, but there are many others. The thing is, when you can even search online, conferences or the conferences for 2025, you will see a lot, and then you can go through it and see which ones that can go. We have the European Association of, is it oral health? That those ones almost consistently would even give you a slash if you are coming from low and maybe waive some part of the registration for you. But I can't say everything. What I'll say is even type in Google conferences or whatever health-related conferences for 2025, and then you can sieve through. The second part of the primary data collection or getting into review. Well, it is good for you to have the experience in both if you have the opportunity. But we know that it may not be, it is, I want to even say it's easier to do a systematic review actually, because systematic review can be very tough, right? So if you have the opportunity of collecting data, primary data, I think it's good to go ahead because that requires a set of different skills. The skills that are needed to conduct review, systematic review, are also separate. You understand? So, should you trade one for the other? No. If you have the opportunity of doing the two, please do. There was a time that I applied for something and it's negative. And the reason is that, they say, fantastic about primary research, this one, that one, but there's a little on reviews and and it's part of, we need somebody that is quite strong in this area. So, you see, that opportunity, there may be other reasons why the rejection came, but I'm just saying that you can't trade one for the other because they require different skill sets in the methodology, even if writing is methodology. So diaspora, we focus on a lot more of review because I understand that it may not be as easy for primary data collection environment. I don't know. I'm not there. So just thinking. But there's also the opportunity for secondary data, right? So even if you don't collect the data for yourself, you are not the one on the field. There's a lot of secondary data in the US, in those places that are very good. Well, you can't collect that kind of data like that in Nigeria. The resources are not there. So you can work on data even if you cannot yourself. So what are for primary data collection? Please, the skill now is you are going to analyze, you go through statistical findings and all those things, which is almost the same. It's just that somebody has collected it for you. I think that will be my response to.
Thank you very much, Dr. Fabide, for the response. I'm sure that was very satisfactory, in fact, more than satisfactory to Dr. Bapalola. So just moving on to the next section, and that's just to inform us about the process for the certificates collection. So to qualify for the certificates, two criteria are going to be made use of. The first is attendance. So the attendance has been carefully noted for the webinar. And the second is filling the feedback survey. So there's a common saying, which I love, and that's that feedback is the breakfast of champions. So we want to know how this webinar went and how we can improve on subsequent webinars. So please take time to fill this survey. It's in the chat box and I'll be sending it again to the chat box. So please go ahead to fill it. The certificate will be sent in within a week from today. But once again, we'll be considering the feedback surveys as well as attendance to send the certificates in. So thank you for attending. I will just invite Dr. Busayo to give the vote of thanks. Dr. Busayo, over to you.
Good morning, good afternoon, good evening. Can you hear me?
Yes, we can.
And I hope you can see me because I can't see myself. Okay, so thank you very much, everyone. On behalf of Research Initiative International, sorry, don't mind me. We say thank you for attending our first webinar. It started out as an idea. We didn't even think that we'll have this number of people, but thank you for everyone that honored our invitation, and especially Dr. Fagbule. I am so grateful. In fact, Dr. Fagbule is a let's say, an encyclopedia of research knowledge, because as it was talking, my brain was just was making connections, and I was like, oh my God, this is what we can do, this is what I can do. And so I learned a lot, and I'm sure that is the same for all of us that are here today. So thank you very much. We would be hosting webinars at intervals. We don't know yet, maybe monthly, bi-monthly, once a year, we don't know, but be on the lookout. You are all on our mailing list. So when we have a next webinar, we would let you know. So thank you once again, and Merry Christmas and Happy New Year.
Thank you, Ma. Merry Christmas and Happy New Year. Goodbye, everyone.
Goodbye. Thank you.